Diastasis recti is a condition where the rectus abdominis muscles, the six-pack abs, separate during or after pregnancy due to the stretching of the linea alba, the connective tissue between the muscles. You can tell if you have diastasis recti by performing a simple self-test. 1. Lie on your back with your knees bent and your feet flat on the floor. 2. Place one hand behind your head and the other hand on your abdomen, with your fingers across your midline at the level of your belly button. 3. Lift your head and shoulders off the floor and gently press your fingers into your abdomen. 4. Move your fingers along your midline above and below your belly button and feel for any gaps between your muscles. 5. A gap of more than 2 finger widths, about 2.5 centimeters or 1 inch, indicates diastasis recti. You can also look for a bulge or a dome-shaped protrusion along your midline when you lift your head and shoulders off the floor. This is another sign of diastasis recti. However, not everyone with diastasis recti will have a visible bulge. If you suspect that you have diastasis recti, you should consult your doctor or physical therapist for confirmation and guidance on how to manage it. They may use ultrasound, CT scan, or MRI scan to measure the degree of separation and rule out any other causes of abdominal bulging, such as a hernia.